Want to be a change agent in your community? Want to do something great? Today's show is just for you. And I'm so excited, Curtis. We have a guest, and we're going to talk all about these great things that are going to make our community safer.
Absolutely. Looking forward to it.
Well, good morning to all of our friends along the Gulf Coast. We are so glad you've tuned in for another episode of the Echo Stop Live podcast. I am Kevin, and I am here with my good friend Curtis. Curtis, how are you?
I am excellent. Excellent. Did I say that 3 times?
You said that 3 times. We're going to get back to that in just a minute, but I have a surprise for you today.
What's the surprise, Kevin? Can I see the surprise, first of all? Can I see it?
I'm hoping so.
Is it really a surprise if I can see it?
It is. But we have Denise Riemer with us today. Denise, how are you?
I'm well. How are you guys?
Good. Well, some of us better than others.
Yes.
But thank you for joining us on this little chat we're going to have for a few minutes and talk about some of the great things the school system's doing in partnership with many other entities around town just to make Mobile and all the Gulf Coast is just as safe as we can be. So we're excited. So we'll just we'll pretend Curtis is
drinking my water here.
Drinking his water. But introduce yourself. Tell our viewers a little bit about who you are and what you do and how you wound up here today.
Okay. So my name is Denise Riemer, and I am the lead social worker for Mobile County Public School System and the mental health coordinator. So that wear a couple of different hats for the school system. This is the end of my 21st year in Mobile County Public Schools, and we have an amazing team of 13 additional social workers and 3 clerical staff who help us in the Department of Social Services.
Wow, that's impressive.
Right, yeah.
So
Denise is a busy lady.
You are, but I hear somewhere in what you said that there's caring for the community and there's caring for these kids that are coming through our school system and the employees that work in our school system. And so before I get to some of the questions I really wanted to ask, I had this other one just kind of pop in my mind. And you know, what is the impact of a social worker in the school system?
So social workers are what we call change agents. And so what we do, I should say we, because I'm one of them too, is we look at the whole child. And what we're trying to make sure of is that not only the student, but the family gets connected with whatever resources they need. And so we're like that connector. Think about Legos. I think about Legos sometimes. We're the connector between home, school, and community.
And you know, you said the whole child. The whole child, people oftentimes don't equate that with being the entire family, the holistic approach to addressing not just the person that you see before you, but everything that connects to that person.
Exactly.
Yeah.
And so that can mean anything from, making sure that child has proper uniforms and school shoes and socks and underwear and things that maybe some of us take for granted, to making sure that student has whatever educational resources they need, if they need additional services in the school setting, to maybe the parent needs some workforce development or job training skills and they've been trying, but they need some extra resume building help or something like that. We do things like housing referrals and, make sure that they have Medicaid or all kids or whatever insurance that they need so that they can access medical and mental and dental health care.
I think a lot of people don't always understand how important it is for a child to have all those things you just described. Even with their parent having something that's a livable wage that allows them to come into that educational environment and actually be open for learning.
Exactly.
Yeah.
We say that a child really can't learn properly unless they're healthy, right?
Wow.
And we're talking about the health of all of the health of the student. So mental health care, social and emotional health care, and just that wellness, that general wellness that children, all of us, not just children, but everybody in that school building needs in order to perform at the level that they need to perform.
I just had this thought pop onto my mind, and I know you're probably excited because it had a lot of room to bounce around for a few hours.
Wow.
But
you said it.
well, I mean, but my head doesn't hurt when it bounces around. It's not like I don't know, going to the gym and hurting yourself.
Okay.
But listen,
Okay.
well, what I had this idea is, it's about preparation. It's about preparing. So being a change agent, from what I'm hearing, is we are preparing the student to learn. We're preparing the student to learn in school. We're preparing the student to learn in society. We're preparing the student to learn at home. We're preparing the student to learn in the to and from school to the home, and all of these different places where, if we really want to have a real conversation, the influences, the negative influences that sometimes alter or deviate the path from what we hope and what we plan and what we pray for, and then they wind up in a situation or exposed to a situation, and that little tiny influence. And so when we talk about preparing a student at school to learn, we also should be focusing, and this sounds like this is going straight up the alley, preparing our community to respond to the issues of violence that we see, or the issues of trauma at the home, or stress. And so all of this, I'm hoping, and I don't have a license or certificate to back this up, but it's just a thought that I'm having, just thinking back and reflecting about putting yourself in a season of learning, is we're preparing people to become the best that they can be. And that has a trickle effect throughout our entire community, does it not?
That's exactly right. And so what we want to do as change agents, as our social work team, is we want to get to that. We want to get to it before it becomes a problem, right? But if we can't get to it before, then we want to react in a way that is going to make that child feel safe and address any trauma that they have encountered, so that they can feel safe enough to be in that classroom setting and learn, and that when they go out into the community, they have the tools and the resources, and have learned some of those tools and resources from our social work team and all of the folks that we partner with in that school setting. So our nurses and our counselors and our administrators and our teachers and our resource officers, all of those safety personnel, we call that the safety team at the school. And so that we can prepare them so that if they do encounter some of those negative influences in the community, they'll know who to turn to.
It's like you guys look for at-risk issues to avoid having at-risk youth.
Exactly.
So, and that's really important. I don't think people really understand the gravity of the work that you all do in the schools to make sure that those things are being identified, and that you are directing those families to the appropriate services so that you can help in public safety mitigate something before it actually occurs.
Well, let's talk about that for a minute, because you bring up an extremely valid point when we talk about at-risk students and their families. What services can be intertwined between the school system and other things around the community? I know there's prevention and intervention programs, but how do you enhance lives by sort of focusing on at-risk students?
So we have a lot of different ways and policies and procedures that we're looking for in that classroom setting, in the school setting, to say, what are the things, where are some of the red flags, right, to identify? And three of the biggest things that we look at are attendance, grades, and discipline, right? So if we look at those three things, those are kind of our markers, our benchmark indicators, that if something is not right in those three areas, then we know that something's maybe not right. So if a child is continually coming to school without their homework, or maybe they don't have their proper uniform on, they're maybe wearing a different shirt, or maybe wearing a hoodie on top of like a t-shirt because they don't have something, or maybe they need some extra food that day. And then, of course, the discipline issues. If we see some behaviors acting out in the classroom, that sort of thing, then we know something's maybe not right. We don't know if it's not right at school. Maybe something's happening at school. Maybe something's happening in the home. Maybe something's happening in the community. So that's when we start asking those questions. And we have a really cool app that we use called Rhythm. And it's an early warning kind of check-in app. And it's used across the district, all 12 grades. And it's like an emoji-based assessment, basically, emoji-based questions. And it's 2 to 5 questions, depending on the age of the student. And they get to kind of tell us how they're doing mentally, emotionally, environmentally, physically, and socially. And so it gives them questions like, are you hungry? Are you extra hungry? Are you tired? How are you feeling in your body today? And so that then sends an immediate alert to our that safety team I talked to you about, that counselor, that administrator, and says, hey, maybe we need to go pull Johnny or Susie and sit down and talk with them and see what's going on. So those are some of the indicators that we use. Certainly some of our testing, and if we ask our people who are in the school building, those teachers, those registrars, those cafeteria folks, our custodians, to be our eyes and ears. Because I only have 13 licensed master's level social workers on my staff.
I thought you were going to say you only had 13 eyes and ears. I was thoroughly impressed.
I know, 13 eyes and ears. But we have, thankfully, thousands of eyes and ears on these children. And that gives us the ability to kind of pinpoint and see a situation and address it right then and there in real time.
Well, what would you say to someone, Denise, who says that why are we making such a huge issue of mental health when we didn't have that issue when I was growing up, and I think I'm perfectly fine, when they're probably not. But
I'm glad you asked that question. Yeah. So May is Mental Health Awareness Month. If you didn't know, I'm making you aware of Mental Health Awareness Month. But truly, I believe that we should just take the mental off of that statement, right? And if we talked about the health of all of us, health includes mental health, physical health, right? Social and emotional health. I know you're, like Kevin said, we're going to open that door about physical health and sometimes getting hurt at the gym and other things like that.
Oh, she did.
All right.
Well done.
But we need to look at the overall health. So were there mental health issues when you and I went to school? Did we have issues? Yes, we did. Did they address them? Maybe not, because the school setting was maybe not seen as that place to do that. But I'm going to say to you that we have these children 8 hours a day, 5 days a week. And so what better place to have this opportunity to address the whole health of students?
In addition to that, we're dealing now with social media. We didn't have social media.
No, we did not.
Kevin, you guys had what, like Stone and something else, right?
Well, it was a small form of paper, but we had to beat it with a big wooden mallet.
But we didn't have those tools,
right?
Those resources that we're grateful to have, but they're also a detriment if they're not used properly.
Absolutely, yeah. And we're seeing a lot of that.
And I mean, what we're talking about are barriers too, right? We're talking about things. What are some of the thoughts that come to your mind when you think of barriers?
Transportation in our community is a huge barrier. So if somebody gets evicted and is, a family gets evicted and they are having to move around and they don't have access to that bus stop that they used to have, or they can't get back to that bus stop. So transportation, that living wage that you said a little while ago, we've got plenty of parents. Sometimes people think, parents are not engaged, right? They have low engagement with their school system and with their kids in school. And sometimes I don't think it's that. I think it's that they're trying so hard to make ends meet. Some of our parents are working 2 and 3 jobs to make ends meet, right? And so transportation, sometimes not having the resources, the actual monetary resources to provide for their family, not having enough food, not having the access to mental health care, right?
And this is why this is so important, because education is key.
Exactly.
Okay? If you are facilitating the opportunity to address these barriers, then you open the door for improved opportunity to actually gain education that will put you in a position of actually not finding yourself dealing with the issues of not having a livable wage, not having this systemic issue where generation after generation you have the same problem with the same family because some of the most basic needs were never met.
Exactly.
And I think this is a great opportunity to talk about hearing from you in the community. So we've got an amazing guest with us on set today, but what we really want is the participation from you, the viewer, because this isn't something you just witness or watch. This is something we're asking you to come alongside with us and help. And so we have an email set up. It's echostoplive@gmail.com. That's echostoplive@gmail.com. We would encourage you to send us an email. Send us your questions. We try to get to at least 1 or 2 questions an episode. If not, we'll certainly answer all the emails that we can in between shows. But there's also a way to report things. If you know something or you're suspecting something's going on and it doesn't necessarily rise to the level of calling 911, we'd encourage you to use our WeTip app. It's an anonymous app. You can call or you can text, and there's QR codes on signs all throughout the community. And that number is 844-251-0644, 844-251-0644. We would encourage you to send us a message We've had hundreds of messages come in. But before we return to this engaging conversation, I'd like to take a minute and just let you watch a short video clip.
When a mother rises up, she can triumph over anything. Mothers Involved Against Gun Violence is about coping together through an unimaginable loss. But beyond that, we unite to prevent future acts of gun violence so all children can live and grow up in a safe community. Join us Saturday, May 27th from 1 to 3 p.m. at Cathedral Square for the Mothers Involved Against Gun Violence Revive Day. There'll be featured guests and entertainment for all ages. We'll see you there.
And I enjoy learning as I watch some of these different commercials that we put in throughout our show. But learning, again, back to the season of preparation, I keep thinking, if you were going to go work out at the gym, you'd stretch first, right? I mean, it seems obvious.
Yes, yes.
No attention to the man in the room here.
So, it seems like that preparation, though, is critical. And some of the other things that I'm thinking about are critical in preparing our society to recover from the stresses of violence and from the stresses of other things that have led to the violence. But there's also other social issues that are occurring aside from violence. We're making great strides. Part of this is not just impeding violence, but improving perception, which is why we bring people like you on, so we can share with people what's actually going on with our viewers, with our partners in solving this problem. But let's talk about homelessness for a minute and mental health services as well. Two different kind of areas, but sometimes they certainly overlap. Where does the school system see engagement on that? Where do you, as a social worker, see engagement on that issue?
So with mental health, I will tell you that we're finishing up our 11th year of a school-based mental health partnership with the State Department of Education, the State Department of Mental Health. We were one of the first districts who signed up for that partnership, and that allowed us to have therapists in our schools, and we partner with some of our community mental health partners in the community, Alta Point Health Systems, The Bridge, Mosteller Medical, ICU Mental Health, and different organizations, so that we can provide those services on site. And what that does, two very important things: it reduces the stigma of receiving mental health services because we have them right there at the school. This therapist at the school is just like another member of the school staff, right? They can do observations, they can see what's really going on in real time, and they can provide those services right there, with parental consent, of course. And then the other thing that it does is it helps the parent, because the parent doesn't have to take off work. They don't have to come get their child, bring their child to a clinic, have those mental health services. So that's very important. We are trying always to expand those services so that we can have those services in all of our schools. Since COVID-19, we have seen an increase, of course, in issues of trauma. Sometimes children have lost parents, grandparents, very close relatives and friends. And we've seen an uptick in just anxiety, just general anxiety, right? Because they were locked down for so long, and then they had to come back into that school setting. Now, I personally think Mobile County Public Schools did a great job of trying to reach children where they were at the homes when they were locked down with educational services. And even some of our partners did like yard therapy visits because they couldn't do the home visit. They couldn't do a visit in the school. So really we have a huge emphasis on mental health services in the school setting.
Would you say that youth today in the schools are more accepting of mental health services than ever before? I would tend to say yes, based off of some of the conversations I've had with young people. But I also hear from those that are my age that are still kind of skittish when you talk about mental health. And I guess the concern is how important is it for the parent to understand that when a child is saying they need some services, mental health oriented services, not to push against it.
That is so important, Kurt. That is like really one of the most important things because people our age who are parents, young parents, we really want parents to realize that yes, your child might have said this before. We hear that sometimes from parents. Well, my child said this before and nothing happened. Yes, but we have to take that very seriously every time the child expresses some kind of mental health issue, and we want to give them the services that they need. Now, we can't, as a school system, we can't make that happen. We can only do it if it is, with parental consent. Right. But we do encourage the parent. We meet with the parent anytime we call the parent and say, hey, this is what's going on with your child, and we give them multiple resources that they can access. But that would be the biggest thing that I would say to parents and the community members is, please don't attach a stigma to receiving mental health services.
And I think it's also important when we're talking about this, just even in the school system, that parents know there are social workers, right? That there are resources. I mean, there obviously is the conversation about, if they know that because their child received something, but what about parents who might be concerned about their child having something? How do they engage? How can they engage with the school system to see where they can come together and prepare this child the best they can?
Excellent question, Kevin. Thank you. So they can call our office at 251-221-4275. That's our main office number for social services. They can also ask at their school and say, hey, I would like to connect with the social worker for this school and or the counselor to see what kind of services there are. And they can ask at their school, do you have school-based mental health here at this campus? We're trying to get it to every campus, but we haven't gotten there yet, but we're working on it. But definitely we want them to know that we're here to help. And sometimes when people hear those two words, social worker, they get a little nervous. And I understand that. Sometimes, you guys know that, with as being in law enforcement, that whenever you see, the police car behind you with the blue lights on, you get a little nervous. And sometimes people do that with social workers as well. But we want them to know our only function is to make sure that their child is receiving the services that they need. Right. And now, Kevin, you asked about homelessness. I would love to tell you about that because we work with so many partners and in the community to address homeless families. The U.S. Department of Education has a little bit of a different definition of homelessness, and really quickly, I want you to think about it this way, and I want the community to think about it this way. If you can't live in the same space every night and that it's safe and sufficient, then according to the U.S. Department of Education, you're homeless.
Wow.
And that means kids who are in unsheltered situations, living in their car, in shelters, in motels or hotels, or if they're doubled up with friends or family because of a loss of housing or fleeing domestic violence or an eviction or anything like that, economic hardship. So we have a long history in our department of working with homeless students, and what the federal government says is we want them to access educational services just like anybody else. So we have to make sure that happens, that they don't have any barriers to getting into school. Like if you had to leave today, Kurt, if you had to flee your house today, what would you take with you? And you had to enroll kids.
That's tough. Yeah. And to your point, I can't even possibly come up with what I could do or what I do. I will tell you this, that we don't realize how important education is and how all these things that are connected directly or indirectly to education plays a part on the education of a child. And not having those things, not addressing those things, often leads to what we're dealing with on the back end of it in law enforcement.
Right.
Yeah. Here's what I'm thinking, and we just got a question that popped up on my screen here, so someone has sent us in an email. But before I get to the email, I'm thinking, I'm listening to y'all talk, and words keep popping in, and I'm hearing restoration, I'm hearing redemption, I'm hearing words, and you're like, okay, what's that got to do with it? Well, if we're talking about homelessness in the way that you defined it, which is pretty powerful when you really think about it, because it's consistency or a lack of consistency.
Exactly.
If we're talking about preparing not only our students and our families, but our community to really attack this issue of how do we just get back on track, how do we get the son or daughter back home, right? So I'm thinking, right, about this sort of line of thought, and I'm thinking about restoration, which gets you back to where you were, redemption, which renews you, and then moving forward, which is progress, because we don't want to just stay where we are. And so I think about all those things, and interestingly enough, Madison, who lives in Mobile County, has written a question, and she's asking, as a single parent, what can she do to stay engaged or to have her child stay engaged over the summer from bad influences while school's out?
That's a great question. So we have, for our summer programming, we have literacy camps and math camps at our school buildings. We also have that's in June. And then we have, that starts, I think, June 5th. And then we have in July, we have our summer school, basically for those students who are trying to catch up or to stay ahead, right? And then we also have some fabulous partnerships with Mobile Parks and Recreation, who have lots of summer things going on. And we have partnerships with Alta Point and Bay Point, who have summer camps. So if that parent is willing to open a chart with those agencies and allow their student to receive some great mental health services, then they can also attend those summer camps. And so the summer camps are not only about, I mean, they're fun, right? But they weave in those great social skills and mental health things that are into the summer camp setting. And so we have, the counselors at our schools have those flyers. And then, of course, I would definitely encourage them to go on Mobile Parks and Recreation.
You know, what I hear in this is I hear public safety throughout all of that, because you guys represent the branches that lead to that big trunk that we all call public safety, because that's the centerpiece of every community.
That's right.
And what you guys are doing is your part that we need you to play in the community, to be those folks that are helping us address those things before they become something that law enforcement has to engage in. Because if the child is active doing something to distract them from negative influences, then that's a good thing for us, and we want that. But I don't think we recognize enough the importance of having agencies that you describe actually doing those things for us.
Are you hitting the final button on final thoughts? That was your final thought?
No, that was my final thought, yeah.
Well, that's pretty good. That's pretty good. You jumped the gun on that, but that's impressive because what we're talking about, and our viewers hear me say this all the time, I constantly go back to, Operation Echo Stop is a four corners approach. But before you can get to the four corners, you have to look at the four pillars that create society. And that's faith, family, education, and government. And here we are talking about one of the pillars. And it's so fascinating because, as important as that is, we're talking about how it's interwoven into the other pillars as well. And if you degrade those pillars, the balance of society is kind of diminished and crumbling. In our job through this podcast and through whatever outreach we can, I know the school system is to get us back on the right path. And it, when you say that, it almost sounds like we're not on the right path. We're on the right path, but to stay on the right path, but to even advance, what's the next step? To have that vision to drive forward. And so to our viewers, we appreciate you tuning in today. This was a really great conversation. I'd love to have Denise come back on the episodes with us again in the future, if she's willing to, and talk more, because education is such a vital part of everything we're doing, especially specific to some of the youth violence issues that we're seeing in the community. How we can reinstill good education in our youth so that they make great decisions as they become adults. And we want to remind you that at Echo Stop, you can send us emails at echostoplive@gmail.com, echostoplive@gmail.com, and of course you can send us in your tips. We'd love to hear from you and take action on some things that you might be concerned about, and that's 844-251-0644, 844-251-0644. Until we meet again, till we have the next episode, want to remind you that you are more than welcome, and we are encouraging you to come alongside us, not just to impede violence, but to improve perception. Thanks again for joining us here on the Echo Stop Live podcast. Have a great and safe weekend, and we'll see you next Friday at 8:30, as we do every week, for the next broadcast and the next exciting news that we have to share with you in the community. Thanks again, and be safe.